Thank you for staying with us. It is time now to know what's on the front pages of Nigerian newspapers. Public affairs analyst Sijibomi Adebiyi Benet is here to review the papers with me. Good morning.
Good morning.
Thank you for joining us.
Thank you for having me.
All right, so we head straight to the papers now, and I begin with the leadership newspaper. CJN quizzes 6 chief judges today over conflicting ex-parte orders. CJN quizzes 6 chief judges today over conflicting ex-parte orders. And to this Nigeria newspaper, as battle for 2023 hots up, no going back on presidency, South lobby North to cede power in interest of justice and fairness. Adebanjo, North should support South, but restructuring imperative. Find details of the story on the pages of this Nigeria newspaper. To the blueprint now. NEF to Matsari, El Rufai, Matawali, Sani Bellu. Your security measures, lockdown on the north. Market restriction, closure of schools, others will worsen challenges. Niger monarch, Katsina lawmaker's wife, 2 kids abducted. You find details of the story on the pages of the blueprint. To the Daily Sun, Paris Club refund controversy. Governors disown federal government over $480 million consultancy debt. Urge banks to ignore promissory note. You find details of the story on the pages of the Daily Sun. To the Vanguard newspaper now. Terror. Royal father kidnapped. Killings choke Niger. Katsina. A gunman on bikes kidnapped district head in his palace in Wawa, Niger State. Wife, 2 children of Katsina lawmaker abducted. 78-year-old brother of Katsina SSG kidnapped. Lockdowns not enough. Go for sustained military assault on terrorists. NEF pleads with northern governors. Kebbi government imposes curfew on troubled towns, villages. You find details on the pages of the Vanguard newspaper. To the Punch newspaper now. Looming hospitals shutdowns. Strike threat ridiculous, says federal government. NARD, as National Association of Resident Doctors. Union Fleet Minister Ngige accuses health workers of intimidation. Right. Well, federal government worried. Johesu accuses government of insensitivity. Minister misleading Buhari union. All right, you find all the details on the pages of the Punch newspaper. To the Nation newspaper now. Federal government moves to stop collapse of health sector. Ngige rushes to Aso Villa, meets with Johesu tomorrow. Doctors reject terms. And to the Nigerian News Direct. Third wave COVID-19 kills 355 in 1 month. Cases surge in Rivers, Lagos, others. To the Daily Times now. Strike will withdraw suit against resident doctors if federal government, speaking there, insists on implementation of no work, no pay policy, discovers 2,000 unqualified names on residency training list, demands refund for 588. Johesu issues 15-day strike ultimatum. To the Daily Trust now. 1 month after BDC operators groan under CBN's forex policy. We've lost 40,000 jobs. You find details there. To the Business Day now. Entrepreneurs sidestep uncertainty to redefine farming in Jos. You find details on the pages of the Business Day. To the Business AM. High interest, port congestion, taxation, endangering Nigeria's leather export. Details on the pages of the Business AM. To the national economy, insecurity, infrastructure, deficit, retard growth of Nigeria's tourism sector as expands the decry nation's 129th global ranking as 770,000 job losses. And now to the Nigerian Tribune. Apprehension as federal government woos investors for 2.472 trillion naira loan. Current debt level amounts to 42.4 trillion naira. Utomi, Mohalu, Ganiu, others warn about looming danger. All right, Sijibomi, let's quickly look at this development with regards to the federal government versus the resident doctors. And the government is saying that they will withdraw suit against the doctors if they return back to work. But the resident doctors are not taking it. They seem to not want to believe the government with regards to this aspect, because that has been the issue for them, the no work, no pay issue, clause there in the agreement. They're saying that government has to remove that, has to deal with that. And now government is saying, you know what, for us to just deal with this thing, you know, we'll return to work, we'll withdraw our suit. What do you make of this?
I believe that reason will prevail and reality is setting in. The way the government started to handle it through the Minister for Labour, Mr. Ngige,
yes,
has not really impressed me, and I think has not really impressed a lot of Nigerians, because you see a minister who is a medical doctor himself, who is supposed to know and be able to consider the enormity of this strike. We have 2 pandemics in Nigeria at the moment. Cholera is killing people in the north, some places in the south as well, but majorly in the north. And the new variant of COVID-19 is rampaging. Just yesterday, Lagos State lost 30 people. 30
in a
deaths.
month, over 300 people have died.
Yes, so, but you know, we're not focusing on it as we used to. So we just believe all is well. Then because there are no lockdowns, no restrictions on gatherings yet, so we really have not really felt it. But people are dying and the families and loved ones are feeling it. So when you are in these situations and you have a minister trying to be obstinate and on the high horse, it doesn't portend understanding and responsibility.
Really?
So yes, so the doctors, the resident doctors on their part as well, they are fighting for their rights, but just like every Nigerian and every organization in Nigeria, we always break the rules when we think we've been shortchanged. Nobody follows the rule of law. No matter the kind of order the government got, be it Jankara or, it's a competent court of law, and you were told to return to work. So maybe the strike will have been suspended again.
But it has been said that from that suit, that it is not that they should return to work, according to them. It is not that they should return to work, that the minister misinterpreted it to the people.
We always have our interpretations in Nigeria to suit our purposes.
Right.
That's one. Number 2 is the fact that every organization in Nigeria, when they go on strike, they still expect to be paid. It's still just acting like the government as well. It's not ethical. Do you pay your driver who did not come to work for 2 months? Let's ask them personally. Do they do that? If you don't come to TVC for 2 months, are you going to get paid without authorization, without approval? So it's still the same Nigerian mindset. It's a national cake. I believe that if you are fighting for a cause and you really want to make your point, thank you. You have to sacrifice.
Haven't they sacrificed enough on the part of the doctors now?
How?
Haven't they sacrificed enough on the part of the doctors?
Every Nigerian has made sacrifices. Have Nigerians been so good to you? So my industry can afford to also go on strike. But you know, we're not really important like that. But you know, everybody is making sacrifices in Nigeria. From the point of getting your own water yourself, getting your security yourself, getting things yourself. We know that the doctors' sacrifices are a matter of life and death. But so many other ones as well. The police also, which is much more dangerous.
So for you now, they should return to work. Or is government saying, okay, we'll withdraw the suit if you return to work? But because some persons are saying that if government is sincere, it should withdraw the suit first and then tell them to return to work.
the grandstanding from the minister is my issue. And at this point, he has made his point not very clear, and he has made his own premise to be unreasonable. Let me use that word. But before now, checking the antecedent, the doctors had a good point. But at the time the judgment came, review it, interpret it, get back to work. It was a suspension. You can always reactivate the strike, so that you are seen as an organization that is not like the government you are trying to fight. That's one. Then the number two is, when are we going to have this sense of patriotism? If we are going on strike, yes, maybe 1 month, 2 months, what's the sacrifice? You're still going to get paid, even when you didn't go to work. It's not right. I'm talking from the perspective of someone that has never been a public servant. So you are cheating me. Because if I don't work, I don't get paid. But if they go on strike, even as when they go on strike for 6 months, they still get paid. So what's the pain in what they are trying to gain? So the Nigerian way of doing things and we've done a bit of research, because there is a strike clause and some other things in Western countries. When they go on strike, they pull funds for themselves to live on. That's why the organizations are there. That's why they pay dues. So for a minimum number of time or period, you take out of the funds, just like a pandemic package. You give it to your members for them to live on, because they're not expecting to be paid. But in Nigeria, that's not the case. So they can always go on strike because they know they will always get the money. But for us private people, for other people that if they don't go to work, they don't get paid, who do we run to?
All right. So, but now the other issue is the issue of Johesu, that is also threatening to go on strike and is issuing a 15-day strike ultimatum. But government is going to meet with them tomorrow. And I'm wondering what you think should be at the front burner, because you had, like you mentioned, we're in a pandemic. There are other issues, cholera and so many other issues that are, ravaging the country as we speak. And a lot of Nigerians are not finding it funny at this point, especially with regards to health. Now that we are going to, the federal government is going to meet with these people, what is the conversation? I mean, we can't have a situation where the whole system is broken down, or shut down as it is.
What I expect the government to do tomorrow, I think they're meeting tomorrow, Tuesday, is to be sincere with the organization, with Johesu, because what Johesu is fighting for, this salary harmonization deal they had since 2014. That's 7 years ago. Sometimes I wonder,
how is it that these issues are not resolved as quickly as possible?
Be very sincere with these people. Let them know the pulse of the government. Let them know what you can do in 3 months, in 6 months, in 1 year. We cannot afford a shutdown of the health sector, because resident doctors, I think there are 15,000. Other consultants are still working. Some
are leaving.
Yes, some low cadre employees are still working. But when Johesu shuts down, that means everybody in the health sector must shut down. So that's a collapse. That's going to be a disaster. And what the government should know is it's always a lose-lose game. So don't let them go on strike, because when they go on strike, you will still shift ground. That's one. And number two, you will pay them for what they have not done. That's the truth. So don't let them go on strike. Moral suasion, persuade them, encourage them, be sincere with them, bring what you have on the table, and give them another 6 months or 1 year to review. Just be honest, be transparent. That's all. We have 3 doctors in that cabinet. We have Dr. Mamora, we have Dr. Enaire, we have Dr. Ngigi. So how is it difficult? You've been part of these organizations before. So I believe that we should have something positive tomorrow, and we don't want to hear any strike from GSO. And for the strike of the resident doctors, we believe that they should call it off. They should also be reasonable, because no matter what, they're going to get paid.
No matter what they're going to get paid. That is what it is that is coming from you now, because they have been saying that they have families, they have, all those responsibilities that they want government to address. Because like we pointed out, these issues, since 2014 for Johesu, doctors are saying for the past 10 years, over a decade, they've been, going back and forth on this matter. Perhaps there has to come a point where this association need to say, let's deal with this head on and tackle it and move on, so that we don't keep coming back to say this matter has been on for the past 10 years, 15 years, one government go, return, we still have this issue dragging.
My point is, I'm not, because there was this report that came out that the medical doctors believe because someone said out of the doctors, so it wasn't like an organization remark, that because they are maybe the most brilliant, so that's why other professionals envy them. So I am talking like this not because I hate them. I'm from a medical family, so doctors, nurses surround me. So, but I'm talking like this because everyone knows the government has failed. So how do we use our organizations?
So they should be the ones salvaging the situation?
No. Let me get to my point.
Okay.
How do we use our organization to come up with restructuring and improvement for the government? Let me tell you what I mean. Find a new way to address issues. I love what the judicial workers did the other time. Now, have they really come up with like a structure, like a plan on how to even revive and improve the medical industry in Nigeria and put it out to the government, so that the next time we're hearing strike, not just about allowances and all that, which are very, very important because they're working and it's a matter of life and death, but something to improve the medical industry, the medical sector, so that your life, the risk to your life is minimized, and the risk to the patient's life is also minimized. Those are the things I want to hear. Not just money, because sometimes they increase the money, inflation also rises, and the money is nothing. So 5,000 that they used to give them was something
at the time.
At that time. So if they increase to 50,000 today, who tells you that in the next 8 years something will not happen and the 50,000 will become 4,000? So those are the things I want our professionals to think about, because we can only do it ourselves. It's obvious those people will not be able to do it for us.
All right. That'll be a fine place to leave the conversation. Sijibomi Adebiyi Benet, thank you for your time.
Thank you for having me.